My message today is to our healthcare workers, the nurses, midwives, technicians, paramedics, pharmacists, doctors, drivers, cleaners, administrators, and many others who work day and night to keep us safe.
During the pandemic, the phrase key worker or essential worker became a shorthand for those who keep our communities running. We clapped from balconies, praised hospital staff, supermarket workers, delivery drivers, and many more. But how did this label affect the lives of those frontline workers? How were people affected who were not deemed essential? And why should we still care about this today? Welcome to On the Move Conversations, the podcast of the Swiss Center for Migration and Mobility Studies, the NCCR On the Move. I'm Julia Litzko from the NCCR Network Office at the University of Neuchâtel. Joining me today is Eloise Thompson from the NCCR On the Move network, who has researched how the term key worker evolved in the UK during the pandemic. And also joining us from Switzerland is Hilmi Gashi from the trade union Unia. He is currently serving as the national head of interest groups, and he is an expert on migration and integration issues. Eloise and Hilmi, thank you so much for being here with us today, and welcome to On the Move Conversations. So before we dive into today's topic, could you each briefly introduce yourselves, tell us a little bit about who you are, what you do? So maybe let's start with you, Hilmi.
Thank you very much, Julia. Thank you for the invitation. I appreciate it very much. My name is Hilmi Gashi. I work as the head of the interest groups at the biggest and strongest trade union of Switzerland, Unia. And basically my job is to organize the work of the interest groups and represent the trade union on different levels and networks concerning migration. On the federal level, at the Commission for Migration and the Commission Against the Racism. It makes me sometimes very sad to see that we do a step forward and two back. But I guess it's the part of game and it's part of the political reality. And I think the worst thing we would do now is to lose the hope and courage. And that's the biggest motivator. I know we have to be hopeful, but we have to be courageous and we have to work to make this place better.
And let's continue with you, Eloise.
Thank you very much for having me today. Thank you to Hilmi as well for your time. I'm looking forward to our discussion. My name is Eloise Thompson. I'm a PhD researcher here at the NCCR On the Move, and I'm a social geographer at the Institute of Geography in Neuchâtel. In my thesis, I look at the key worker category or the essential worker category as a way of understanding the socio-economic impacts of the COVID-19 pandemic in the UK. This project was formed back in the midst of the pandemic, I think when we couldn't imagine life going back to normal, as we think of it now. And we thought that the sort of pandemic legacies would be much more than they've turned out to be. I think the key worker category really demonstrates this. We all know who they are. They're the cleaners, they're the bus drivers, the people that make our lives move every day. And I think they gained a huge amount of visibility during the pandemic, and then this seems to have faded away. So I think it's really important to dig a bit deeper into who these people are and why this category matters.
Definitely. And then maybe let's dig deeper into your research. Could you tell us a little bit more about your research? What is a key worker? And how did you go about studying this topic in the first place?
Mobility is a really important part of our everyday jobs. And then during the pandemic, there were people who couldn't work from home. You had the lockdowns from March 2020 in the UK. And then when Boris Johnson, our Prime Minister, announced the first lockdown, he said that people needed to limit their journeys to most necessary or most essential. And for some people, this meant continuing working almost as normal. We had this new idea in a way, or this unprecedented idea of frontline jobs. So my PhD, I broke it down into three different aspects. So first, where did this category come from? The second, how has it come to be so politically relevant during the pandemic? And I'm looking forward to talking to Hilmi more about this as well. And then third, since the end of the pandemic, in what ways do policymakers and other actors, including unions, as really important actors in the kind of governance of work and labour, how are they still talking about the issues around key workers, if at all? So this involved some policy tracing, following the category through the pandemic and through the policies around the pandemic to limit the spread of coronavirus. And then also expert interviews with a range of different stakeholders, which also included actors in government, civil servants, also union representatives in the UK, campaigners, employers, and some key workers themselves.
And could you maybe give us 2-3 takeaways from the research?
So I think key workers, we all came to understand them perhaps towards the end of the pandemic as the more precarious workers. But actually, in fact, key workers are almost a third of the workforce in the first place. And this could include anyone from your cleaners and bus drivers, as I've already mentioned, but also hedge fund managers were also included as key workers. So I think the first finding is exactly that key workers is a much broader category than perhaps we think. But within this category, there are some really important dynamics around the worsening of inequality and precarity for particular kinds of key workers. And then when it comes to the legacies of the pandemic, I think, why has there not been legacies is one of the things that I'm most interested in. And key findings have been around particular actors, most specifically trade unions, who have been very active on this front in trying to use the pandemic as a window of opportunity to improve some of the rights, especially of more precarious workers.
Hilmi, could you maybe tell us a little bit more about your experience when you were working with the trade union Unia in Switzerland during this time? What was the kind of support that you were providing to workers, especially frontline workers?
I remember this time in March, a few days before the lockdown. I was in Pristina, in Kosovo, on a retreat of an organization. And we already saw there that some people from the US or UK, they didn't come because there were already restrictions or like people were in panic. When I returned to Switzerland a few days later, we had this lockdown. And as the trade union, we were facing two situations. We had the situation where our members working in restaurants, in hotels, they were affected by the lockdown, but not the ones cleaning, the ones in logistics, like running the country on the go, and also on the concrete sites, people working on the concrete side. So we had to deal with two challenges. Explain to the people what the pandemic means and what does that mean for them if they are not allowed to work. And the other side, to say to the people who had to work how they could protect themselves. We started really by learning, by doing, and step by step, we started to inform the people what are their legal rights, where they can say no, where they can say yes. We established also a hotline for our members in different languages. It's one of the strengths of the trade union Unia because we communicate in different languages. So basically, we had to deal with people who lost their jobs, but also people who had to work and they were afraid. And the third thing, which sometimes people forget, those who had to work, how to deal with the situation when you have your kids at home. And the fourth thing, it was more the infrastructural, the tight living situation, also access to the infrastructure because homeschooling needed computers, needed access to internet. So all these challenges were part of our daily work.
I wonder specifically for those people who were labeled essential, who were labeled as key workers, what would you say were the key risks that those people were facing?
At the beginning of the pandemic, one of the first viruses, the federal government said, keep the distance. How could two people working on the concrete side keep the distance when they had to carry together something very heavy? Keep the masks. But were the masks provided? At the beginning, there was no need for protection with the masks, and then suddenly there were masks. And who's going to control that? We had people who were belonging to this category of people who were very vulnerable on health issues. So how can you protect them? And how can they deal with some situation where they know they are needed, but they are also vulnerable? And it was really not only finding legal solutions, but also encouraging, empowering people just to deal with different situations. I remember one woman said, I would go to work. I'm not the vulnerable, but my husband, yes. When I come home, what does it mean when I get infected? Do I risk his life? And this was also challenging on a human perspective, but as a legal situation also.
And Eloise, from what Hilmi was describing, is this also something that you saw in your research, sort of the consequences of being labeled a key worker, being labeled an essential worker?
Yeah, absolutely. I think so much of what you've said reflects the experience in the UK and what a lot of my interviewers have told me as well. And there's also a lot of trade-offs as well, because in the UK schools were open, but only for the children of key workers. And there was a lot of contention around who counted as a key worker to send their children to school and who couldn't. On the other hand, you don't want to have so many children in school that the teachers are at risk as well. Because you have children coming from key worker homes where their parents are doctors in hospitals, and the risk of infection is really high. So how do you have the trade-off between childcare needs on the one hand and then the safety of teachers also as key workers on the other hand? These are really difficult decisions to make. And I think, as you said, there was also a lot of learning on the job, a lot of learning throughout the pandemic. It's very easy now to be judgmental of policymakers and decision makers, but I think this was a time of a lot of high uncertainty and high risk as well. It was very difficult to find the right balance between keeping things open and keeping things closed. Yeah, I think a lot of what you said speaks back to the same experiences.
The point you mentioned, judging them, I know that in some points they were also doing their job, and I think they did a good job. At the beginning, providing the hope, like saying to the people, hey, we care. And financing the companies, like being very open and very fast in providing the support for the people who had to stay at home in terms of paying the wages. On the other hand, this learning by doing was very important, that the civil society, the trade unions and the others could function and put in the focus people who were not meant to be supported by this measure, because supporting the economy, supporting the enterprises, giving the pro bono credits to the small enterprises, it was a good thing. But how did they calculate them? On which basis? So you had also small businesses, one woman, one man business. They were supported with tiny amounts, and they were struggling. They were really struggling. We had, as I mentioned, the undocumented people. They were struggling. People working in private homes, like cleaning ladies and cleaning men in the private households. And as I said, it was sometimes very hard to push them. For example, when we started the alliance to support the people who were excluded from the measures, it was really hard. But I think this was a good challenge. And I think we did the best, but I'm anyway still skeptical if we really learned the lessons. And did it really change something? For example, we had this symbolic action to upload to the essential workers, especially to the nurses who went every day to the hospital to risk their lives. But did it change their working conditions? Are they better paid? Do they have a better balance between life and work? No. And that's what I think. We worked very good in the crisis, but we couldn't make a carry-over effect on today.
Yeah, that would be my next question. When we look at the legacy of the pandemic, how do you think this label of key workers, how did it affect the actual essential workers? How did this label sit with them? Do you think it felt mostly symbolic, or did it have any meaningful impact on their lives during COVID, but also after?
I don't know if it's the same experience in Switzerland, but maybe the most surprising thing from my research was when I spoke to key workers themselves. And I said, no, I don't really associate myself with this label. Like, I know my work is important and it contributes something, but I don't feel strongly like I identify with this label of being a key worker. So that was maybe a bit surprising, but maybe it shouldn't have been. These people do this work, especially in jobs that are perceived to have a lot less societal value. These people do these jobs anyway. Whether it's because they have to, it's the only job available, it suits them. And although they say, yes, it was nice during the pandemic, people came and clapped for us on the doorsteps at some point, it almost became a bit patronizing. Because it was like, we go for work every day, it doesn't make a difference. And if you're not going to follow up with meaningful change in terms of improving working conditions, improving pay, for example, it's a bit meaningless. But in terms of the legacies, at least in changing the working conditions or daily life of being on the move, being in these frontline jobs, I think very little has changed, at least at a policy level. One thing I thought was really interesting, what Hilmi was saying, the pandemic really revealed how important the work of civil society actors and organisations are. This work has always been really important, but even more so during the pandemic, and in the UK as well as in Switzerland. Unions and civil society organisations and campaigners, local community groups filled in a lot of the gaps. Unions at the moment in the UK are really pushing to use the COVID inquiry as an opportunity to reflect on what happened in the UK and to bring forward some lessons learned.
And what's the COVID inquiry?
It's a really important but very slow and tedious process that's taking place in the UK. And it was also brought about because a group called the Bereaved Families for Justice campaign They were a civil society group that came together during the pandemic from families of key workers who died from COVID. And they formed this campaign during the pandemic, and they were the first to call for an inquiry. That was still in the midst and the height of the pandemic, to review exactly what happened and the decisions that were made. As we already discussed, this was a time of high uncertainty. It's hard to exactly judge the decisions that were made, but I think it's really important, if there were ever to be a future pandemic or a crisis like this, that we try and make better informed decisions so that some of these deaths could have been prevented, would be in the future.
That's really interesting. Hilmi, do you know if there are similar reflections happening in Switzerland?
In Switzerland, usually we had huge campaigns of the right parties blaming the people, be it's their fault being on minimum wage or living in poverty. The pandemic showed to the people there is a structural problem we have in our economy and in the function of this society, especially the pictures in Geneva with people standing on the food lines. I think this changed a bit the attitudes, but also showed that if the governments or the cities or the majors of the cities are willed to change something or to do something for these people, they can. Zurich did a special fund for the people who were undocumented. We as a trade union started this alliance to support the not supported people till then, so it showed it can work. The other thing, the other side of the medal is that in some points, the government, the policymakers acted very fast, as I said, supporting the economy and supporting the people with legal status. But I saw also a lack on implementation of policies to protect migrants. One example, the asylum procedures were ongoing, even if there was a call for stay at home. So they forced people in the asylum procedure to go to the hearings, even if they had no people who could be with them because the representatives of the NGOs couldn't be present on the session on the interview. And also the lack of flexibility on dealing with social assistance, helping people to get this assistance without being afraid to be punished. And one point that a lot of policymakers couldn't see is when you were on social assistance in Switzerland, you risk to lose your permit or your permit C to be changed in B, and you, prospectively, you diminish the chances to become a citizen of this country. So this showed also a lack of flexibility on facing the situation and giving the support to these essential workers. Most of them, large number of them, are migrants. So in some way, when I talk to the people, it was this famous video message of Samaruga, then president of the Swiss Confederation, when she said, we, the Bundesrat, the ministers of the state, we care for you. And a lot of migrants, they were not sure if they were meant with we care for you. So it was really who is meant by we and why we do not belong to the we. Why should we be treated in other way? Because the pandemics didn't make any separation who will affect and who not. There was not important which passport do you have, it's what job do you do.
And I think this is one of the biggest contradictions of the key worker label or idea. On the one hand, they are essential to our country and the nation, and they are seen to be sacrificing themselves for us, so to speak. They were the heroes of the pandemic. They were on the front lines, contributing to the national effort. I think Boris Johnson said that about 100 times a day. And then on the other hand, it wasn't really reciprocated with the kind of gratitude or any kind of meaningful exchange. We still have such strong ideas about nationhood and citizenship, and even in this moment of crisis and contributing to the national response to the crisis, even then you see the hierarchy between migrant workers and citizens.
So I understand from this discussion that there were some positive measures that were implemented to protect key workers during the COVID pandemic, both in the UK and in Switzerland. What were those positive measures, and did some of them last? And then what are still the biggest gaps in how we recognize and support people who keep our communities running day to day?
I think some of the main positives that come from the pandemic is that we now have a language to talk about essential work or key workers. I think that is really valuable, and I think we should continue to conceptualize this category and think about it, use it in academia and policy making and political lobbying, I think it's useful. I think it reveals a lot about the people that we need in society and the kind of work that keeps all of our lives going. And I think it's a useful category to have. A lot of research has gone into using that category to reveal more socioeconomic inequalities as well. Once we have categories, we can use it to measure things, and that's useful. And some of the more positive changes that have come about, the statutory sick pay in the UK, so that's a permanent change that will come in next year, I believe. That means that in the UK it will now be brought up with European standards that people will be paid from the first day of sickness. And that's seen to benefit workers and employers and the sort of ongoing services in essential sectors. I still think that we have or maybe one more positive as well, is that maybe it also revealed and made visible the very valuable work done by civil society actors and organizations, specifically trade unions, I think is a huge one, and the kind of work that they can do and respond very quickly on the ground during a crisis, even when government actors are still working with policy and legislation. I think unions can act quickly. They have representatives already in organizations. They're very democratic. They can collect data and evidence very quickly, as well as communicate with people. I think that's really important. And then perhaps some of the biggest gaps, I still think we have an issue around precarity. And that although we have on the one hand gratitude for key workers and their sacrifice and so forth, we haven't followed this up with any meaningful change. Since the pandemic, since 2022 in the UK, there's been a lot of industrial action and strike action, mostly for doctors, but also for teachers as well, to try and improve their pay and bring it up in line with inflation. That hasn't necessarily manifested in really significant change. I think that could move faster, but also it's not just doctors and teachers. I think we need to still think about key workers as a much broader category of people who keep services going, this sort of dirty work that we're a bit ashamed to admit that we even see, and I think this gap still exists.
From my point of view, I mentioned it once, but I would like to recall it. In Switzerland, we have this narrative of the migrants are useful, this utilitaristic view on migration. And during the pandemics, we could see they are not only useful, they are also essential. So this shift of a narrative, because these people kept the country running, often at a great personal risk for their health. And I think this was not really appreciated enough. We could see, as you said, when there is a lack of policy or the policymakers are not courageous enough to push forward, the decisions should be making because of political calculations, that there is a need of civil society, of trade unions, of organizations who work on the field, grassroots groups who are sensitive and have sensors and resources to do something and to increase the voice and to raise the voice to make propositions how to deal with the situation. I think in the public view, this could help for the further discussions, also concerning poverty, that it is structural, but I don't see any further legal change. When we talk of foreigners, this law is still in power, punishing the social assistance. It didn't really change. And I think in some ways it changed the way the society sees these people, but it didn't change their legal status. And that's the work we have to do. We have to put much more efforts on changing the legal status, the policy, and not to punish these people because they are poor or because they can't make enough money, but see what can we do on a structural level to make their lives better, so they can take care of themselves and their families. These people are very essential to our economy and to our society and should be treated with dignity and should be treated as equal citizens, even if they don't have the red passport.
I think that's a very nice note to end the conversation on. Thank you so much, Hilmi. Thank you, Eloise. Thank you for being here and taking the time to share your expertise, to share your thoughts.
Thank you.
A big thank you once again to Eloise Thompson from the NCCR on the Move and to Hilmi Gashi from Unia. You can find links to both of their work in the show notes. I'm Julia Litzko and this has been On the Move Conversations. Thank you for listening and until next time.